Today's Good Health is brought to you by Sullivan County Community Hospital. If you've ever experienced a migraine headache, you understand it's more than just a headache. Some suffer from chronic migraines, meaning the occurrences are often and it can make life very difficult. Sullivan County Community Hospital's Pain Management Center can help. GDL producer Lindsay Noble explains.
Chronic pain can be debilitating.
For the most part, chronic pain is pain that persists beyond the time expected for healing of that type of pain. Generally, we look at it as 3 months or more of having pain.
And living with chronic migraine can change your daily life. About 13,000 Americans deal with chronic migraines, which are different from regular migraines.
I think we all have headaches from one time or another, but migraines are associated with nausea, vomiting, sunlight, or just light hurts your eyes. Activity makes the headache worse. It's the type of headache where most people will go and lay in a dark room for hours, sometimes days.
Sullivan County Community Hospital treats and prevents chronic migraines with Botox.
So Botox is botulinum toxin that is harvested and used, or grown and used, for treating chronic migraines. A significant portion of the population suffers from chronic daily migraines, which is for the most part defined as somebody who has 15 days a month or more of migraine headaches.
So is this Botox the same as the type used for cosmetic purposes?
It is, but it's completely different application. In cosmetic, you're basically, for lack of a better word, paralyzing the very small muscles of the face so that you don't see wrinkles. The same Botox is not into the muscle, it's subcutaneous into the skin, and it's done in regions of the face and head where the nerve that causes migraines, and it affects the trigeminal nerve from causing headaches in the first place.
The Sullivan County Community Hospital Pain Management Center treats patients differently than other providers.
Typically, in a pain management center, we usually get the worst of the headaches. You know, there's primary doctors or even the neurologists that don't do Botox or other treatments that we do, typically run out of options, and even headache specialists will sometimes refer to us. We don't see a lot of mild headaches. As a matter of fact, I don't think I have anybody that I treat for a mild headache. We're talking about debilitating headaches that affect people's lives, their quality of lives, and so we tend to use quite a bit of Botox, actually.
If this procedure sounds like it might help you or someone you know, insurance will usually cover it.
It is covered by insurance, but you have to have tried many different options. If somebody comes and has a chronic daily migraine, I'll try other options first, and then if they fail, then we'll try Botox. And they usually do fail, those other options, for chronic daily migraines, specific category of migraines.
Dr. Callahan has had great success with the Botox treatments. In fact, he has never had a patient miss their appointment.
Because they still have that sentiment, I never want to go back to the way I was before I was getting the Botox injection. So there's a lot of loyalty with that medication.
Sullivan County Community Hospital has 2 pain management clinic locations. The main facility there at the hospital on North Section Street, Suite B. They can be reached by phone at 812-268-2556 at that location. They also have a second location that's located on South 7th Street in Terre Haute and can be reached at 812-281-2243.